Dr. Cadlick, for someone without insurance, do you know the out-of-pocket cost of a complete blood count test?
No, ma'am, not immediately.
Do you have a ballpark?
With a copay, ma'am?
No, the out-of-pocket, just the typical cost.
I do not, ma'am.
Okay, a CBC typically costs about $36. What about the out-of-pocket cost for a complete metabolic panel?
Ma'am, I'd have to pass on that as well.
You have any idea? You want to take a ballpark?
I would say $75.
Okay, 58.
Getting closer.
How about flu A? The flu A test.
Ma'am, I would take a guess at about maybe 50.
43. This is like the Price is Right. Flu B.
Too high again. I would probably say 44.
That's good. How about the cost of an ER visit for someone identified as high severity and threat?
I'm sorry, ma'am. What was the question again?
How about the cost of an ER visit for somebody identified as having high severity or high threat?
High severity, but ma'am, that's probably about $3,000 to $5,000.
Okay. That is $1,151. This all totals up to $1,331. That's assuming they aren't kept in isolation. Isolation can add up for one family already, $4,000. And fear of these costs are going to keep people from being tested, from getting the care they need, and from keeping their communities safe. We live in a world where 40% of Americans cannot even afford a $400 unexpected expense. We live in a world where 33% of Americans put off medical treatment last year. And we have a $1,331 expense, conservatively, just for testing for the coronavirus. Dr. Redfield, do you want to know who has the coronavirus and who doesn't?
Yes.
Not just rich people, but everybody who might have the virus?
All of America.
Dr. Redfield, are you familiar with 42 CFR 71.30, excuse me? 42 CFR 71.30. The Code of Federal Regulations that applies to the CDC. 42 CFR 71.30.
I think if you could frame what it talks about, that would help me. I
Okay.
don't relate.
Dr. Redfield, I'm pretty well known as a questioner on the Hill for not tipping my hand. I literally communicated to your office last night and received confirmation that I was going to be asking you about 42 CFR 71.30. This provides the director may authorize payment for the care and treatment of individuals subject to medical exam, quarantine, isolation, and conditional release.
That I know about, and my office did tell me that. I just didn't know the numbers, ma'am. That's Congresswoman.
Great, so you're familiar. Dr. Redfield, will you commit to the CDC right now using that existing authority to pay for diagnostic testing free to every American regardless of insurance?
Well, I can say that we're going to do everything to make sure everybody can get the care they need.
Reclaiming my time. Dr. Redfield, you have the existing authority. Will you commit right now to using the authority that you have vested in you under law that provides in a public health emergency for testing, treatment, exam, isolation without cost, yes or no?
What I'm going to say is I'm going to review it in detail with CDC and the department.
Reclaiming my time. Dr. Redfield, respectfully, I wrote you this letter along with my colleagues, Rosa DeLaura and Lauren Underwood, Congressman Underwood and Congressman DeLaura. We wrote you this letter 1 week ago. We quoted that existing authority to you, and we laid out this problem. We asked for a response yesterday. The deadline and the time for delay has passed. Will you commit to invoking your existing authority under 42 CFR 71.30 to provide for coronavirus testing for every American regardless of insurance coverage?
What I was trying to say is that CDC is working with HHS now to see how we operationalize that.
Dr. Redfield, I hope that answer weighs heavily on you, because it is going to weigh very heavily on me and on every American family.
Our intent is to make sure every American gets the care and treatment they need at this time of this major epidemic, and I'm currently working with HHS to see how to best operationalize it.
Dr. Redfield, you don't need to do any work to operationalize. You need to make a commitment to the American people so they come in to get tested. You can operationalize the payment structure tomorrow.
I think you're an excellent questioner, so my answer is yes.
Excellent. Everybody in America hear that. You are eligible to go get tested for coronavirus and have that covered regardless of insurance. Please, if you believe you have the illness, follow precautions. Call first. Do everything the CDC and Dr. Fauci, God bless you, for guiding Americans in this time. But do not let a lack of insurance worsen this crisis.
And I would just like to echo what you said. It's a public health, a very important public health, that those individuals that are in the shadows can get the health care that they need during the time of us responding to this outbreak.
This is why you should vote for Democrats. Katie Porter hasn't even been in office for one single term, and already she was able to secure a commitment from the CDC Director to offer free testing for all Americans for coronavirus, regardless of whether or not they have insurance. She came in prepared and knowledgeable and did in less than 5 minutes what the White House hasn't managed to do for weeks now. In fact, all the White House has actually managed to do was squander its opportunity to get out ahead of this pandemic. The administration declined to use the World Health Organization's test that countless other nations took advantage of. Virologists in Berlin had produced the first diagnostic test for the disease all the way back in mid-January. And by the end of February, the WHO had shipped tests to nearly 60 countries, but not the United States because our government opted to decline the test. We didn't even use them as a bridge until the CDC could produce its own test. And so we were left with a delay that continues to this day, during which those who carry the virus have been able to spread it for months without knowing who was infected. To this point, we've only conducted 11,000 tests in total, while South Korea is performing over 10,000 tests every single day. And yet, because they know who's infected and who should be quarantined, their cases are actually falling, while ours are surging. That is a direct result of our government's mismanagement, and so a problem that could have been mitigated has instead been exacerbated. Even now, still the White House is only looking out for big business. Trump's economic advisor Larry Kudlow confirmed that the White House is considering intervening to help the travel industry, which includes airlines, cruises, and hotels. So interesting that the Trump administration is floating a bailout for hotels, isn't it? They're even considering a bailout for shale companies, for big oil, an industry that just recorded their best earnings in years. Just last year, BP recorded a 105% increase in revenue. Chevron was 61% higher, Shell was 36% higher, and so clearly, the fossil fuel industry should be our top priority right now. And yet not once did the Trump administration float a bailout for poor people, for the 87 million uninsured or underinsured Americans, for the people who are continually overlooked and written off by this administration. By the way, all of this is happening while the Trump administration is still fighting to repeal the Affordable Care Act in the courts. The only law we have protecting coverage for pre-existing conditions. The only law we have ensuring that 20 million more Americans have health coverage. And the White House, during a pandemic, is trying to repeal this law. Forget their constant attacks on Medicare for All, on programs designed to expand healthcare coverage. Republicans don't even want those currently covered to have access. In fact, even a bill to simply lower prescription drug prices, H.R. 3, the Elijah E. Cummings Lower Drug Costs Now Act, has been languishing in the Senate, where Republican Senate Majority Leader Mitch McConnell refuses to bring it up for a vote. The bill was passed out of the House, the work was already done, and yet still the GOP is so afraid of the prospect of helping Americans that their only solution is to bury it. And look, while Democrats are not perfect, there is only one party that consistently and breathlessly fights for regular Americans, fights to expand healthcare, fights to keep drug costs low, and doesn't squander every cent of taxpayer money on handouts to the richest people in this country. There is only one party practicing good governance, and it's not for kickbacks, it's not for PAC money, it's not so that foreign dignitaries will stay at branded hotels or buy their daughter's jewelry or their son's real estate. It is to protect Americans. Katie Porter is doing the job she was elected to do, and every single Republican should take note of exactly what that looks like.